Welcome to the SMA podcast series, A Day in the Life, a publication of the Southern Medical Association's Physicians in Training Leadership Working Group, composed of medical students and residents, whose mission is to provide a forum to plan and design new educational activities for physicians in training. Hello, and welcome to the SMA Physicians in Training podcast. This is the podcast by Physicians in Training for Physicians in Training. I'm Natalie Weiss, a third-year medical student at Tulane University School of Medicine in New Orleans, Louisiana, co-chair of the SMA Physicians in Training group, and your host for today's podcast. Today's topic is the benefit of organized medicine for physicians in training. Our guest today, hailing from Eastern Virginia Medical School, is Miss Julie Gee. Julie recently completed her third year of medical school and is now pursuing a year-long clinical research fellowship in dermatology. She's the current leader of the SMA Physicians in Training Personal Development and Wellness subgroup. Congrats on that, by the way.
Thank you.
She's served as president of the Women's Health Club at her school and is on the editorial boards of several national medical student journals. She also mentors high school students in her local community. Man, she's so involved. Thank you for being here today with us, Julie.
Thanks so much, Natalie, and thanks for the great introduction. I'm really excited to be a part of this podcast today.
All right, with all that said, please get ready for Helping Each Other Thrive, How Medical Associations Can Benefit Physicians in Training. So the first question that I have for you is, how can medical associations promote student wellness and mental health?
To start off, student wellness is a topic that I feel really passionate about, and I think it's extremely important to discuss throughout training. So there's actually several studies that have looked at medical student wellness. And one study that was published in Academic Medicine, it actually surveyed medical students and found that students who enter medical school actually have better mental health than their non-medical peers. However, they leave medical school with higher rates of depression and burnout compared to peers of their similar age. And that kind of suggests that there are aspects of medical education that's very challenging for trainees. And I think these topics are really important to talk about because they not only impact our personal well-being, such as, our health and sleep, physical exercise, to more serious things like substance use and increased suicidal ideation. But it also impacts the way that we could provide care to our patients. So several studies have shown that these negative experiences in medical school is strongly associated with increased rates of cynicism and burnout in students. And that could affect the way that we connect with our patients in the future and provide care. It could also affect our relationships with our colleagues and contribute to the culture of medicine. So in essence, I think when we take care of our own well-being, we're also making sure that that we become the best doctors we could be for our patients. So one study that was really interesting from 2018 in family medicine, this study actually conducted focus groups with medical students from the University of Washington and Penn State. And they were looking for, what are the specific or common challenges that students face during training. And what came up a lot was the feeling of isolation and lack of support that students were feeling. And this could be due to a number of reasons. So I think many of us are far away from our families during medical school. And you also don't have as much time to communicate with families and friends because of the demands of training. And then in addition, in the second half of medical school, students embark on clinical rotations. So you're meeting new people and switching teams every couple of weeks. And you might also be at a decentralized training site where there may be only one or two medical students at either the rural clinic that you're working at or a community clinic that you're at. So all of these factors could displace medical students from their regular support system, and it could build up over the years and be very impactful on our well-being. So from this study, students also were asked, what they found were helpful during their medical training to kind of cope with these challenges. And a couple of the things that was reported often was being able to find a support group during your medical education, and also having a forum where you could freely talk about your experiences with other people who might be experiencing the same things, and feeling that you're not judged by talking about these issues. So that's exactly what we're trying to do at SMA. I think medical associations are a fantastic way to join a community of people who are very excited about medicine and passionate about improving their communities. And not only does it offer you the support, a potential support system, it also provides a forum where you could talk to physicians and residents and other medical students about your experiences. And it doesn't necessarily need to be the people who are evaluating you. So that kind of free communication, free and open communication, I think could be very valuable to students. And I gotta say, at SMA, one of the unique things that I really found was that everyone just really wants to help you succeed, and they're happy to offer you the resources to help you achieve your goals, whatever they might be. So that's something that I've really enjoyed about being a part of SMA. And then in addition, Natalie, so the Physicians in Training Leadership Group that you're the chair of was established this year, and that specifically focuses on, medical students and residents, and the goal is to provide students and residents with the resources for them to succeed, not only during training, but also early in their careers. So that is a great community that we're building, and we're working on establishing that medical students could, I think, really benefit from. And then lastly, just want to mention that, studies have shown that learning effective ways to deal with stress could also help decrease feelings of frustration and burnout during training. So one of the goals that we have on the personal development and wellness group of PIT is to provide resources to students to help them confront these stressful situations, whatever they may be, that come up during medical training. And this includes topics such as incorporating practices like meditation and mindfulness into training, and promoting personal health, such as, getting adequate sleep, nutrition, and exercise during training. And I think all of those topics hopefully can be beneficial to student well-being.
Wow, what a great introduction to the usefulness of the SMA and the SMA Physicians in Training. I can certainly attest to the third year of medical school being a difficult, trying time for us. And in my personal experience, everything that you have said has rung true. The folks at the SMA have been very supportive, and the folks at the SMA Physicians in Training have served as a new close-knit sort of family unit for me. It's been really great having that support system there. So next, I kind of wanted to delve into the tips, the more specific tips that you have for students who are looking to gain more exposure to a specialty or advocacy and community outreach.
Yeah, sure. So I think mentorship is really important during training because it not only exposes you to what the next steps of your medical career looks like, but it also allows students to kind of see how other physicians practice and use these early experiences to reflect and determine what kind of physician they want to be in the future. And from my experiences, pretty much everyone I've reached out to for guidance and mentorship during medical school have been super willing to help as long as you express genuine interest in what they do. And I think finding mentorship at your medical school or training program is really valuable for getting that in-person exposure and also a long-term relationship with physicians in a specialty that you're interested in, or physicians who have experience doing a particular type of advocacy or outreach that you might be interested in doing in the future. I think medical organizations also provide a unique opportunity to find mentors because it allows you to kind of broaden your reach beyond your training program or your community and find physicians throughout the region, so throughout the South. And that allows you to see kind of what that specialty looks like or what that advocacy work looks like at a different training program. And another thing that I think is very useful for finding mentorship in a medical association is being able to find mentors who may be working in a specific niche that you're interested in. So, for example, if you're really interested in volunteering in an underserved country, you might find a physician who is actively doing that outside of their practice. Or if you're interested in a particular research topic that may not be available at your current program, finding mentors through a larger organization like SMA is a great way to find these opportunities. And then, yeah, I gotta say, so we asked our group leaders in the physicians in training leadership group about, what they like about being a part of a medical association. And something that came up over and over again was the fact that students felt really inspired by the opportunity to meet other physicians who are making a change in their communities and even in the country, and kind of seeing what the role of a physician looks like, not only in the clinic, but outside in their communities. And that is something that is really motivating to students, and also is a great opportunity to see and kind of get the resources to how to make those impacts yourselves later on in your career. And I know in the physicians and training leadership group, we're also working on some really exciting things coming up in the year. So our mentorship and community outreach groups have been doing a lot of things and planning on providing students with resources that could be really beneficial. So Natalie, you've worked on the Day in the Life podcasts that I think are fantastic. It kind of shows you the day-to-day and what that looks like in different specialties and different training programs. And that's a great way to kind of gain more familiarity with different programs across the region. And I think in the future, we're also hoping to establish a mentorship program to help trainees, medical students, residents to become mentors if they're interested, or to find mentors in an area that they might be interested in.
I've definitely found, and I'm not sure if this is true for you, Julie, but the physicians in training group is especially great for these medical students who are undifferentiated, because we at the SMA encompass every specialty, every stage of training, and we want to create this culture of mentorship where we have the SMA board of directors who, reach out to the SMA residents, who reach out to the SMA medical students, and so on and so forth. So we've got this just continuous line of growth and mentoring that we've been working on.
Yeah, that's such a great point. And I gotta say, even, at the annual conference last year and over this weekend, just listening to all the interesting research in areas like surgery and other areas that I might not have really gone out and learned about myself, but having that exposure and seeing what innovative things other trainees are doing across the South is really great exposure, and kind of lets you see what other specialties are all about. So yeah, definitely, I think being a part of an organization like this is a fantastic way to get exposed to a lot of different specialties.
Yeah, as well as you mentioned that some of the physicians are doing work in underserved countries as well, which I found really interesting. I wouldn't have even thought of that as an option, but now that I know about it, and that sort of thing happens with a lot of different topics. You find out that people are doing different things with their practices, and you really fall in love with the idea of something.
Yeah, it's kind of like maybe you don't know how broad you could dream until you see other people who are, may have similar ideas or are doing similar things. So it's such a great way to gain more exposure to what medicine could mean for an individual. And then I think another really useful thing about being a part of a community like this is being able to see what other students are doing at their medical school or their training program. So some of the really exciting community outreach efforts that they're doing at their school has really opened my eyes to, like maybe we could implement that at my school or in my community.
Yeah, and also ways that medical students are combating this problem of this really stressful training, and you can incorporate that into your own life. So that kind of leads me to my next question, which is, can you talk with us about how the Physicians in Training Personal Development and Wellness subgroup can help with some of those challenges that come up during training?
Yeah, sure. So I think one of the goals of the personal development and wellness subgroup is to identify what are the common stressors and challenges that medical students are frequently facing throughout training, and then to hopefully provide students with the resources to deal with some of those challenges. So I think a couple of topics that come up often during training is first, personal finances and educational debt that could contribute to stress, and also it could pressure us in some way to choose certain specialties. And then also, as we're getting more exposure in the hospital and working with different groups, there may be ethical conflicts that come up. Also, the challenges of dealing with death and grief for maybe, that we're very new to and we don't have much experience in as well. We start our clinical rotations, and also dealing with the culture of medicine and some of the hierarchies that you have to navigate. So I think these are topics that we want to help students not only discuss, but also hopefully provide them with kind of experiences from residents and young physicians who have experienced these things throughout their trainings already, and who could talk about what they found were helpful in helping them deal with these topics. So not only do we want to provide evidence-based resources to help students deal with these challenges, but also from firsthand experience that I think is really helpful, and just hearing about what somebody who has already gone through these situations have done.
Absolutely. And that mentorship network that we just keep growing and growing throughout our region and throughout the country has really proven to be a very beneficial thing to our students and residents. And so, with that, I think that we've reached the end of our episode. Thank you for tuning in to the Physicians in Training podcast today. There are thousands and thousands and thousands and thousands of podcasts out there, and you've chosen to listen to this one. For that, you have our appreciation. If you enjoyed this podcast, please share it with your friends. Our 100% completely unbiased opinion is that they'll love it, and you'll be the talk of the town. Please visit sma.org/podcasts for more information on our organization. Become a member of the SMA Physicians in Training group, or follow us on Facebook, Instagram, Twitter, LinkedIn. You name it, we're there. Until next time.
Thank you so much.
Thank you for listening, and stay tuned for more Physicians in Training podcasts. To view all of SMA's podcasts, visit sma.org/podcasts.